It's a great day to talk CBD creams and oils for topical pain relief. I'm Dr. DeFabio. CBD from hemp oil is what we're going to be talking about today, and how it's used as a topical pain relieving liniment. It's very common. It's available everywhere, just about in all 50 states right now, I believe, over the counter. And again, it's a hemp oil extract, which means there's very little THC in there. There's no psychoactive effect. So let's be clear about that. We're not talking about the medicinal marijuana. We're talking about hemp oil extracts, CBD. So how can you tell if it's going to be beneficial for you? Well, you got to read the ingredients. And once you read the ingredients, you can determine if it's going to be a good product. You look at the concentration, you look at what's in there, and you look at what your goals are. So right now, our goals are pain relief. That's what we're talking about. So I just have a couple of creams randomly chosen. CBD plus oil, gold formula, full spectrum hemp extract, which is what we talked about, so that's good. It has the ingredients, 100 milligrams of CBD. We don't know how much per serving, but the jar is 100 milligrams. And it's got sweet almond oil, beeswax, and glycerol, stearate, and a bunch of other ingredients on the bottom here, but no artificial dyes or scents. So that's good, no artificial dyes or scents. It's got a lot of emollients, a lot of things that are going to soften your skin with CBD, which means it's going to set on your skin. Probably really good for someone who has a skin lesion like psoriasis or eczema, something like that. I don't think it'll be really good for pain control because it's not going to penetrate through the skin. Beeswax, sweet almond oil, those are oils. Hemp oil, it's an oil. It's going to sit on the skin. So it might be good for skin types of things where you want moisturizing and healing, but I don't think it's good for pain control. CBD Clinic pain relief ointment. Oh, now we're going right after pain. They're claiming this relieves pain. Let's look at their ingredients. CBD hemp oil, good, so we know it's there, it's safe. 400 milligrams. So this is 1.55 ounces. This is 1.3 ounces. So there's a lot more CBD in here. There's peppermint oil, tea tree oil, eucalyptus oil, clove oil. So lots of good oils in here. We look at the label, however, under active ingredients, and it lists camphor, 11%, and menthol, 16%. Wow, that's really high. So you're going to get a lot of icy hot. You're going to get a lot of counter irritants. Menthol will give you a cooling effect. Camphor kind of gives you that cooling, heating effect. So it's an icy hot. 17% icy hot is very, very strong. So this will give you a counter irritant effect. I don't know if it's going to decrease the inflammation, but it doesn't really address the pain directly. It addresses it indirectly because it irritates the skin with the menthol and the camphor, and then therefore the brain doesn't sense the pain in the area. So it doesn't go after the cause, but very strong stuff. The next one we have is Phyto-Zol, transdermal phytocannabinoid complex serum. What are their active ingredients? Well, it's 100 milligrams of microencapsulated, time-released photocannabinoid complex, CBD. So the CBD here is encapsulated. Well, and what? It's encapsulated in DGME, which is a transfer agent. So here, there is no menthol, there is no camphor, there is no methyl salicylate. It's just CBD, which is an oil, which is encapsulated, surrounded in DGME, which allows it to get through the skin into the deeper tissues. I do know this does not get into the blood, by the way. I did research that. It doesn't say it on the label. It just stays in the superficial tissues. So this will actually penetrate through the skin. It won't sit on the skin. So the CBD gets into the skin, through the skin, and once it penetrates, then it can become an active ingredient at the deeper levels, and it binds with the endocannabinoid receptors in your body, going after the cause of your problem and suppressing the pain and inflammation that way. So a transdermal agent that goes through the skin and doesn't sit on the skin, so the active ingredient goes through the skin. Only company I know that has that, whether it's CBD or not. CBD that just sits on the skin with emollients. CBD with counter irritants, so you feel the icy hot, so you know something's working, but you don't know if the CBD is working. So the bottom line is, what are you looking for? Do you want to go after the pain and inflammation, or do you just want to do a counter irritant? If you just want to do a counter irritant, I would say skip the CBD and just go to a really high concentration methyl salicylate, menthol camphor formula that you can buy anywhere as well. If you want to use the CBD, it makes sense to do the Phyto-Zol, because then you're going to be able to get an ingredient that penetrates through the skin, scientifically proven to go 6 times deeper than other companies penetrate. There's the information. Now you know. I'm Dr. Donald DeFabio. Thanks for tuning in.